Hello and welcome to the Anxiety BC website and to this special interview on panic disorder. I'm Dr. Michael Catchpole and my guest is Dr. Adam Radomski. Dr. Radomski is an associate professor of psychology at Concordia University in Montreal. Dr. Radomski, thanks very much for doing this.
It's my pleasure.
Dr. Radomski, can you tell everybody what is panic disorder?
Well, I think before you can understand what panic disorder is, you need to understand what a panic attack is. And a panic attack is an event during which you feel an overwhelming sense of doom or a sense that something bad is going to happen. And that's accompanied with a whole bunch of different physiological sensations. So your body starts to do a lot of different things.
So it's really bad, I guess is the simple way to put it, right? It feels extremely unpleasant.
It's a very intensely unpleasant experience. People will often believe that they're dying, that they're having a heart attack, and the most common response to panic is to go to emergency. That is what most people will do.
Very interesting. And this can happen at night as well, am I right?
Yes, and nocturnal panics, the ones that happen at night, can be the most scary. They'll often wake people up who are terrified because they don't know what's happening to them.
So it's the catastrophic thought is sort of the spark, and then the subsequent thoughts are the gasoline on the spark? Is that?
Yes, the cognitive theory of panic says very clearly that panics are caused by catastrophic misinterpretations of your bodily sensations.
Fascinating. All right. What can people do? People watching this, what kinds of things can they do at home to help themselves?
Well, the good news is that there are a lot of very effective things that people can do to treat their panic. The first one is to read from a trusted source, like the information that's available on this website or the books that are recommended here. Another thing that's really helpful, probably the most helpful ingredient in treating your panic, is something that's called interoceptive exposure. And what that means is exposing yourself to the sensations that bother you most.
So you deliberately induce some of the panic sensations in yourself?
Yes, and the way that we recommend that you do that is in a way that's under your own control. So start easy and work up towards something more difficult.
Say dizziness was one of your symptoms. What would you do then?
Dizziness is a really easy symptom to expose yourself to because you can use a spinning chair. You can even sort of spin around on your feet. And the idea would be that you'd start by inducing just a little bit of dizziness, wait for that dizziness to go away, and then when you're feeling a bit more comfortable, get yourself dizzy again.
And then watch your body resolve this back to normal again.
Absolutely, and we know for a fact anxiety always goes away. So no matter how much dizziness you bring on, it will go away.
Fascinating. What about hyperventilation?
Hyperventilation is another really good exercise that we would recommend. It tends to bring on a lot more physiology or a lot more bodily action or bodily sensations than other exercises. So most people wouldn't try hyperventilation first, but after you've got some experience, for example, with chair spinning or running up and down stairs, hyperventilation is a great exercise, and it will bring on a number of different sensations, including shortness of breath, lightheadedness, dizziness, sometimes even blurred vision, numbness, tingling. And again, those will also go away. The only important thing to remember about hyperventilation is to make sure that you're sitting down because it can make people very dizzy.
So if one is beginning to have a panic attack, for example, what should one do?
Well, the number one message that you need to remember if you're having a panic is that this is extremely uncomfortable, but it's not dangerous and it will go away. And often the phrase that we use is to ride the wave of panic. So allow that anxiety to come on, don't fight it, and wait for it to go away, and I promise you it will.
Fascinating. Dr. Radomski, thank you so much. My guest has been Dr. Adam Radomski from Concordia University.